Yeah, Sayer, he's a boy. When he came here to our hospital, at that time he was 2 years of age. And then he came with some kind of pale and high fever. And we checked the blood test, and he has a very high white count, white blood cells, and he got leukemia. So at that time he was 2 years of age. So we treat him like a full course of chemotherapy. And actually, and he was diagnosed with acute lymphoblastic leukemia. It's one type of leukemia. Actually, this type of leukemia, it got response to the chemotherapy. But when he has a chemotherapy for a while and he has some kind of the residue of the tumor left, even though it's small amount number, but it's a high risk of the relapse. So that's why we decide to treat him with the bone marrow transplant. The reason why we want to put him for the bone marrow transplant, because he has a high risk of relapse. At that time, he hasn't relapsed yet. So we decided to do the bone marrow, and then we got a donor for him, and the donor is his father. Usually, father or mother cannot donate a stem cell because the HLA is not matched. So, but in this case, the father has HLA is not matched to the hip, it's a half match. We call the haploidentical. However, we performed the transplant around 4 years ago, and then we got quite successful, even though he had some kind of complication, but it was resolved. And right now he was 4 years already, and he's free of the leukemia, he's doing well, he's growing well, and then he turned back to the school already. Yeah, so right now we have a very good program to cure the leukemia, especially the leukemia in the kids, the one who need the bone marrow transplant, especially we call the haploidentical. Since some of the patients, not just only leukemia, some of the patient who needs the bone marrow transplant, like a thalassemia or aplastic anemia or some kind of disease, and this is some kind of blood disease, and if he needs the bone marrow transplant and the patient couldn't find a donor, like a match sibling so father or mother can donate a stem cell. This is some kind of, I would like to suggest, because the bone marrow transplant, if the patient needs the bone marrow transplant, the sooner the better result. So that's why I would like to emphasize that we have a very good program and good successful program of haploidentical transplant. And it's available in Thailand, and then father or mother can donate the stem cell, and we got them quite successful. Not just only the leukemia, but the other disease like a thalassemia or aplastic anemia.